National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi there, Naturopathic Doctor Jonathan Beatty here, health expert at Nationalnutrition.ca. Today I want to talk about dental health. It's one of those areas of health that's often overlooked because we don't talk about it with our general family doctor. It's something we basically put off till it's time for your annual dental cleanings. That being said, dental health is one of the most important areas of your health care to take care of. The reason behind that is that it's, your mouth is the gateway to your intestine and your digestive tract. And if it's not functioning properly, if you're not able to, chew properly, break down your food, you're not going to be able to liberate all the healthy nutrients out of your diet, and you're going to end up with some level of nutrient deficiency, some level of digestive concern, and some level of possible digestive disease. Additionally, infections in the mouth can actually spread to the rest of the body. It's for that reason, oftentimes if people have a heart condition, they often have to take things like antibiotics before they have dental work done. The reason is that if that dental work actually releases the infection into the body, it can actually cause heart problems. So that's why some people have to take a prophylactic antibiotic when they have dental work done, and it's to actually prevent heart disease. So that just goes to show how important dental health is. If you have chronic dental problems, chronic infections in your mouth, there's a good chance that those could actually be spreading to your heart and creating heart disease. This is one of the reasons I'm a very big proponent of getting regular checkups, making sure you get regular dental cleanings, and deal with any dental issues as soon as possible. Dental infections, they can be hard to pick up. Some dental infections, they won't even show up on an x-ray until the infection has gotten so severe that you can lose up to 50% of the bone in your jaw in that area before that infection can be found. So, if you're suspicious, if you have a lot of pain, if you have fevers, if you have chronic sinus issues that you can't explain, they're not related to an allergy, they just came on one day, there's a good chance that that could be related to a dental infection. Again, your sinuses are connected right down to where your teeth insert into the jaw. And because the infection can't come out through the tooth, it gets pushed further up into the body. That can affect the sinuses. Or, as I mentioned earlier, that can transfer systemically into the body and affect organs. The most common one for that is the heart, although there are other areas that infections can cause problems. I've even seen in one of my patients, they had a problem with an infection in the skull in an area called the mastoid. They had what we call mastoiditis, which originated as a dental infection. And in fact, what we had to do is have them have that dental infection treated in order for the mastoiditis to go away. So this is again why I'm such a big proponent of proper dental health, making sure your teeth are healthy, making sure they work well. That way, again, you're preventing certain types of infections, as well as ensuring that you have adequate chewing, adequate digestive function. And one of the old sayings is infection protection does start in the mouth. There's a few different things you can do to ensure adequate oral health. Obviously, regular brushing, regular flossing, really important things to do. And regular does not just mean sticking a toothbrush in your mouth twice a day. It actually means, brushing for at least 2 minutes, ideally 2 to 3 times a day to ensure that you're, getting a good, proper cleaning. Just sticking a toothbrush in your mouth is not actually brushing your teeth. So ensure that you actually spend a good 2 minutes, 3 minutes every time you brush your teeth to ensure you're cleaning them adequately. Flossing at least once a day, again, helps clean out those areas that your toothbrush can't get to. And oftentimes it's that, little bit of food remnant left behind that leads to the development of an infection in the first place. And this is why it's so important that you have good dental hygiene, because that can actually help prevent infection and ensure that your teeth are around for a long time. When you have to have them replaced, when you have to have implants, that can be very expensive. So again, that ounce of prevention is definitely worth a pound to cure, as having something like a dental implant done can be quite costly as well. So again, maintaining your dental health right from the get-go. If you've got children, really instill in them what proper toothbrushing is. Make sure they spend the time brushing their teeth. Make sure they're brushing properly. If you're not sure how to properly brush your teeth, there's lots of services available through public health, through a dentist or a dental hygienist. They're often more than willing to teach you the proper ways to brush your teeth. Next time you're in for a checkup, just run it by them, ensure you're doing it properly to ensure that you get to spend as minimal time as possible in the dentist's chair. Like any good physician or medical practitioner, a dentist's goal should be to see you as little as possible outside of your routine cleanings. So if you like this video, please check out more of our natural health videos, subscribe, and if you have any questions or comments at all, please post them below. And always remember, knowledge is health.